On Friday, August 21st, testing reports emerged confirming what South Africa had seen coming for weeks. A total of 600,000 coronavirus cases confirmed. As of writing, South Africa has suffered around 640,000 total cases of the COVID-19 disease. Yet even though they've had more infections than countries like the United Kingdom and Italy, there have been far less fatalities and a lower death rate overall. South Africa doesn't have better hospitals than European nations. In fact, she is generally considered a developing country, and many hospitals in South Africa are already underfunded, so this clearly isn't the case. So what's the secret to South Africa's low COVID death rate? Of South Africa's generous 600,000 plus coronavirus cases, 14,000 infections have led to fatalities, and 550,000 cases have recovered so far. At just over a 2% mortality rate, South Africa holds a substantial lead over the United Kingdom, Italy, Belgium, and Mexico, all of whom have suffered at least one death in every 10 confirmed cases, according to statistics from the Johns Hopkins University. Take Italy, for example, which has a similar population to South Africa. Though there have been significantly less infections, with statistics approaching 300,000 confirmed cases at over 35,000 fatalities, the mortality rate does not even compare to South Africa's. Reports from coronatracker.com suggest an 88% recovery rate for coronavirus patients in South Africa compared to Italy's 76% recovery rate. These recovery rates and low fatality counts are impressive. If there's something we can learn from South Africa's mitigation strategy, we should be taking notes. So how is it achievable? Cases of coronavirus began appearing in South Africa in early March, with speculation that the first infection came from Milan, Italy. Borders were shut to internal travelers, alcohol was banned, and the national lockdown was enforced with millions told to stay home. Cases didn't reach the thousands for all of March and most of May, probably due to the sweeping measures enforced by South African President Cyril Ramaphosa. These restrictions helped to slow the initial spread of COVID-19, allowing health authorities to gather data based on infection rates in other countries and prepare for the fight. South Africa's 21-day lockdown quickly extended as infection rates began to climb throughout June. Citizens were, however, much faster to adopt face masks and coverings, generally obeying the government's lockdown rules, with the added benefit that crime declined overall. Cases peaked throughout July. According to Statista.com, Italy has a 13% youth population, while South Africa has a much more considerable 1/3 youth population, which is believed to have contributed to the high recovery rate and low death rate during the peak. Age, says Tim Bromfield, a regional director at the Tony Blair Institute for Global Change, is the highest risk factor when a group of people is infected with COVID-19. Africa's lower average population was protected from what could have been a very high death rate. Less people in South Africa live into their 80s, and so there were far more cases in young adults than, say, in Italy. It is easy for a government to become complacent or overconfident when looking at raw numbers and pull the rug out anticipating the event is finished. So far, this doesn't seem to have been the case with South Africa, which quickly reinforced restrictions when signs of a possible second wave or surge in cases arose. President Ramaphosa has acted logically and cautiously so far, and though he has voiced his desire to lift restrictions as soon as possible, is evidently still acutely aware of the impact the spread of COVID-19 continues to inflict on South Africa and could cause if rules were abandoned too soon. It's also important to note that South Africa is by no means whatsoever a perfect scenario. 600,000 people were still infected, making it one of the most severely impacted countries on the planet. And it's still possible a second wave could target older populations more than the initial peak. South Africa also didn't get through the lockdown unscathed. As one of the most unequal countries in the world, according to Statistics South Africa, much of the poor population, especially homeless people, suffered considerably due to job loss. It's estimated that about 60% of the population depends on the labor market. The damage done by the pandemic will hang around for a long time yet, and so will the fight against COVID-19, scientists say. The war still rages on. This was my first fully animated 26 Dimensions video. How did you like it? Were the facts presented well? Are there any topics you'd like for me to cover in future videos? You can leave your thoughts in the comments below. If you enjoyed this analysis of South Africa's coronavirus situation, please subscribe. You can also support my channel at patreon.com/26d and see all new videos up to 3 weeks early. I've left links to my sources and citations in the description. Thanks for watching.